Hello, my name is Matt Giannetti. I am an assistant professor of medicine at Harvard Medical School and an allergist immunologist at Brigham and Women's Hospital in Boston, Massachusetts. I'm here to talk to you about systemic mastocytosis. In particular, we're going to be talking about education and support, as well as patient education in non-advanced systemic mastocytosis. We're also going to touch upon support services and support groups for patients with all subtypes of systemic mastocytosis. These are the aspects of SM patient management that are very important to treating a patient with SM and taking care of them in all aspects of life, as opposed to simply their immunologic or oncologic disease. So, patient education is critical to successful management. When I say patient education, there are really kind of like many facets of patient education. There's a couple here that I would particularly highlight. So trigger avoidance, right? So you need to teach the patients what are their triggers, how predictable or unpredictable they are, and how can they identify their triggers. Most patients aren't able to avoid things that they don't know about. So education in a clear, kind of thoughtful manner is really important here. Periprocedural education is really important too. This extends not just to the patient, but often the patient care team too. So the anesthesiologist, the surgeons, the gastroenterologist for a scope, etc. Finally, we want to talk a little bit about an anaphylaxis action plan, an ED response plan, and then a couple of other things such as medication adherence and support groups such as the Mast Cell Disease Society. So let's first talk about medication considerations in patients with SM. So there's a lot here in this slide, but I want to highlight a handful of medications that are kind of usual suspects is what I would say. So first off is NSAIDs in terms of the pain medications. All NSAIDs, whether it's ibuprofen, Toradol, meloxicam, can cause symptoms typically in a dose and frequency dependent manner, meaning the more frequently the patient is taking the medication, the higher the dose the patient is taking the medication, the more likely they are to have symptoms. This is primarily because these medications inhibit the cyclooxygenase enzyme. It is not an IgE-mediated reaction, and so many patients can tolerate small quantities. But again, during the specific clinical context, such as surgery, the body is in an inflamed state, if you will, and patients are more likely to have reactions. So please keep in mind the NSAIDs. The second one here that I would call out would be the opioids. So patients with SM tend to tolerate the synthetic opioids better, such as fentanyl, as opposed to the natural opioids like morphine. And Dilaudid's kind of in the middle as a semi-synthetic opioid. Other things here, so general anesthetics, local anesthetics, these can all be administered with caution. And in the setting of surgery, patients obviously need a neuromuscular blocker for induction. So the name of the game here is not necessarily to strictly avoid them, but to have a conversation. So anesthesiology is going to want to know, okay, well, what can I use? What do I have to be cautious about? What is recommended for use? So this is a guideline mostly used for clinicians to kind of guide the conversation, steer the conversation towards medications, procedures that are going to be safe and well tolerated. Addressing the medication triggers. So it is not practical to avoid all potentially triggering medications. And even outside of practicality, it's like often unnecessary. So we get around this in a couple of ways. One, we're going to talk to the patient and the other treating physicians, again, anesthesiology, surgery, gastroenterology, et cetera, whoever it may be, about our concerns for specific medications. So, generally I'll try to avoid vancomycin. Well, if this is first line, then we talk about what other options could we use instead of vancomycin. NSAIDs we talked about previously. Vaccination, so this can be a trigger for some patients, but not always. My stance here is that anybody who's had a problem with vaccination previously should try pre-medicating with antihistamines prior to vaccination. You should not ever use steroids as vaccine pre-medication. That defeats the purpose of vaccination. One final plug here is that all patients with mastocytosis should be vaccinated according to CDC guidelines, whether you're a kid, whether you're an adult. It is not a reason to not get vaccinated. It is very important to get the routine vaccinations. Other resources, so there are plenty of available resources for both patients and clinicians to help guide them to an answer for any specific question. So the NCCN guidelines for patients for systemic mastocytosis was released not too long ago. This is a nice compendium of information that you can use in terms of treatment, diagnosis, a whole host of information. The Mast Cell Disease Society is the largest advocacy organization for folks with mastocytosis and mast cell activation disorders. They have a lot of good information on there, most of which has been vetted by practicing experts in the field, myself included. And then I would hop down, so you see GARD and NORD, but I would also hop down and specifically highlight AIM, so the American Initiative in Mast Cell Diseases. This is a North American-based organization where we, further the cause of mast cell activation disorders. One other nice and relevant thing here, though, is that we've identified a handful of centers of expertise. So if you live somewhere in a rural location and you're trying to figure out where is the next closest center of excellence that I can refer this patient to, AIM is great. The ECNM is essentially the American counterpart that's primarily based in Europe. So if there are Europeans listening to this, ECNM is going to be your go-to point of contact. All right, so thank you for joining me today for this video. I hope you found it useful as a clinician or even as a patient looking for more information about your disease. I would also highlight that we have a more in-depth look at non-advanced systemic mastocytosis. It's a 60-minute accredited CME continuing medical education program, which can be found at www.exchangecme.com. Thank you.